Democrats created a horrible system called Obamacare to try to fix a worse system or a equally bad system. I don't know. It's been so bad for so long. But still, if Republicans don't make any progress on this in the next year, I feel like that any healthcare problems in the healthcare system could get blamed on Republicans. So it'd be nice to have some sort of proactive approach to it. Do you have any ideas that are cooking in the Congress that you feel like could perhaps see the light of day to the public?
Well, yes. So healthcare is obviously something that's very important to me. It was one of the first bills that I introduced when I came to Washington. I put out a plan a couple of years ago called that was the our case for healthcare freedom. And I would argue that we've not done a good job as Republicans getting that out there. It's why I've tried to on an individual basis. But I'd say we're making progress. The president tweeting out and saying, wait a minute, why are we going to subsidize insurance companies and enrich them
Hmm.
when they make 85% of their revenues from the federal government? And we're just going to throw more money at insurance companies when American families are struggling? No. Why don't we give those subsidies to the American people? Now, hold. I don't love subsidies. I would rather clean the system out and have competition. But if you're going to have some subsidies for some people who might need it, yes, I'd rather it be a health savings account and an expansive ability for the American people to go shop. Now, if you want to get prices down in healthcare, the fundamental issue you have to address is expansive use of health savings accounts where your money goes into those accounts and your employer's money. Okay, that's really important.
Yeah.
Employers get a tax break after World War II wage controls. They get a tax break for paying for my health insurance, which is really basically health management by bureaucrats with Blue Cross or Aetna or whatever. Well, instead of that, let's have them get the tax break for putting it into a health savings account. Now I can go shop. If we did that one thing and then open it up to direct primary care, health sharing ministries, Medishare, and actually deregulated insurance, now 1,000 flowers bloom. Everybody can go out and get it. And we'd still have guaranteed pools to make sure everybody's covered. And you can get prices down. I bet you could cut prices in half like that in terms of actual healthcare. So we need to be on offense saying, I'm for doctors and patients. They're for insurance companies, big hospitals, and bureaucrats. I'm for lowering prices through options and affordability. They're for micromanaged care from government and corporate bureaucrats and corporate cronyism. I think we can win that narrative.